My name is Stephan Anderson. I am a diagnostic radiologist. I work at Boston University Medical Center, and I am specialized in thoracoabdominal imaging. The problem that we have in the clinical care of cancer patients is correlating our diagnostic impressions with the remainder of the electronic medical record. Things including the laboratory results and, very importantly, the histopathological results, which are often obtained several days or even weeks after our initial diagnostic impressions on the non-invasive imaging. And by non-invasive imaging, I mean ultrasound, CAT scan, or MRI in my clinical practice. The reason that's a problem is that it eliminates the capacity for ongoing education in more of a real-time basis. For example, in our clinical practice, I may make diagnostic impressions on several dozen cancer patients in any given week, but I rarely have the follow-up as far as laboratory values, as far as they relate to the patient's cancer status, or importantly, tissue diagnoses, which would be very important for our correlation with the diagnostic imaging. Now, while it's possible for me to look up all of that information in the electronic medical record, in today's clinical environment, having the time to do that is simply not realistic. And therefore, my problem is having a real-time, time-efficient method of correlating the patient's diagnostic imaging results with the remainder of their cancer-relevant portions of the electronic medical record, very importantly, tissue diagnoses. A solution to this problem may be information technology based, and a solution to this problem would allow us to provide real-time ongoing education to a large group of clinical diagnosticians. In that fashion, it would improve our clinical capacity. It would also provide for a more unified clinical cancer care team, which combines both clinicians, imagers such as myself, as well as pathologists, being unified into one more closely knit cancer care team.